Hello everyone, I am Janella Joan DAHILIG together with Miss Deshirie Nicole Pagdilao, and we are going to tackle about Attention Deficit Hyperactivity Disorder or ADHD, and we will be discussing the characteristics, causes, impact on development and learning, identification and assessment procedures, and as well as classroom strategies. So what is attention deficit hyperactivity disorder? It is a disorder marked by an ongoing pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. It is a brain disorder that affects how you pay attention, sit still, and control your behavior. It happens in children and teens and can continue into adulthood. It is the most commonly diagnosed mental disorder in children. And under ADHD, boys are more likely to have it than girls. There are two types of ADHD, the inattention and the hyperactivity impulsivity. Let's move on to the characteristics of ADHD. Under inattention, they are failed to pay close attention to details or make careless mistakes in schoolwork. They have trouble staying focused in tasks or play. They appear not to listen even when spoken to directly. They also have difficulty following through on instructions and fail to finish schoolworks or chores. They also have trouble organizing tasks and activities. Also, they avoid or dislike tasks that require focused mental effort, such as homework. They also lose items needed for tasks or activities. For example, toys, school assignments, pencils, etc. They are easily distracted. And lastly, they forget to do some daily activities such as forgetting to do chores. Under hyperactivity impulsivity, fidget with or tap his or her hands or feet, or scream in the seat. They also have difficulty staying seated in the classroom or in other situations. Also, be on the go in constant motion. They run around or climb in situations when it's not appropriate. They also have trouble playing or doing an activity quietly. They also talk too much, blurt out answers, interrupting the questionnaire. They also have difficulty waiting for his or her turn. And lastly, they interrupt or intrude on others' conversations, games, or activities. Let's move on to the causes of attention deficit hyperactivity disorder. First one is heredity. ADHD tends to run in families. Brain physiology is also one of the causes. Sometimes ADHD symptoms develop as a result of unrelated medical illnesses that affect brain functioning. Diet is also included as one of the causes. Refined sugar or food activities, artificial colorings, and preservatives. And also environmental factors, such as poor nutrition, infections, smoking, drinking, and substance abuse during pregnancy. And lastly, premature birth.
Let's now proceed to the impact on development and learning. There is a constant need for movement because children with ADHD have a hard time regulating the movements of their bodies. It can be difficult to sit still for extended periods of time. To combat this, students may create excuses to leave the classroom. As a result, they miss out on important instructions and lessons that may make it easier to complete assignments later. The next one is classrooms have too many external distractions. In a room full of other children, the number of external stimuli increases. It is rare to find a completely quiet moment. Children with ADHD are easily distracted, and the constant squeaking of a chair, tapping of fingers, or voices in a hallway can make it hard for the child to hold their undivided attention to the task at hand. Another one is their thoughts outrun their bodies. For students with ADHD, it usually isn't the failure to learn that creates an issue. but rather the gap in the ability to carry that understanding into their schoolwork. This may result in failed tests, trouble completing homework, or writing assignments, and an inability to turn assignments in on time. Next one is challenges with filtering thoughts and choosing the right time to share them. Hyperactive, impulsive children tend to blurt their thoughts out before others are finished speaking. This can create an issue with other classmates, especially during group projects, and may interrupt the teacher during important instructional time, affecting not just the child's ability to hear instructions, but the classes as well. Beyond that, this may have an effect on your child's social life. And the last one is thoughts tend to drift. ADHD affects learning by inhibiting the child's ability to hold focus. Not paying attention makes it hard to remember what the teacher says regarding lessons, assignments, and due dates. Therefore, the child's ability to learn the material and complete homework may suffer. Let's now move on to the identification and assessment procedures to ADHD or attention deficit hyperactivity disorder. Under assessment, there's no simple test such as blood tests exists to determine if a child has this disorder. Diagnosing ADHD is complicated, like putting together a puzzle. Next one is assessment should be conducted by a well-trained professional, developmental pediatrician, psychologist, psychiatrist, neurologist, SPED diagnostician, who knows about ADHD and all other symptoms similar to those of ADHD. Next one is diagnosis is based on observable behaviors, symptoms in multiple settings. An assessment must include the following: thorough medical and family history, physical examination, interviews with parents, the child and the child's teachers, behavior rating scales completed by parents and teachers, observation of the child, and lastly, a variety of psychological tests to measure IQ and social and emotional adjustment, as well as to indicate presence of specific learning disabilities. Let's now proceed to the classroom strategies. The first one is build a strong relationship with the child's parents. And this classroom strategy is one of the important strategies that teachers must consider. Ask about the child's strengths, weaknesses, interests, and achievements outside of school. This will help you get to know the child better, which is especially important. You should aim to communicate with the child's parents frequently and send encouraging notes home about progress. The second one is educate fellow pupils. If a child in your class had ADHD, you should educate the other children in the classroom on the condition. You must ensure you frame it positively to reduce potential cases of bullying. Consider allowing the child to get involved in the explanation and tell other students what it's like. Another one is establish effective seating arrangements. You should sit the child with ADHD near to you. This will help you monitor if they are on track. You could also sit them in an area with few distractions, such as away from doors, windows, and noisy students. A useful tip is to sit the child close to a pencil sharpener and a bin. Next one is establish rules and routines with input from your students. Establish short and simple classroom rules that are easy to understand. Frame all rules positively. Tell students what you want them to do, rather than what you don't want. For example, instead of saying no messing around when you come into class, say something like, when you come into class, sit straight down, make routines and stick to them. Another one is be simple, clear, and direct. You should give directions in simple terms and simplify all instructions, tasks, and assignments to the best of your ability. You should also ensure that you have the child's full attention before issuing any instructions. Be patient and prepared to repeat instructions frequently. Simplicity, Clearness and directness shouldn't just be adopted verbally. Establish eye contact to clearly indicate to the child that you are speaking to them. Next one is break things up. Divide lessons and large projects up into smaller chunks and vary about your content and materials. For example, use workbooks, games, and electronic devices if you have access to this. This is more likely to keep a child focused and decrease some traits of inattentiveness. Another classroom strategy is reward good behavior. It's very likely that a child with ADHD will lack self-esteem and believe that they are simply naughty. Use a reward system like stickers or a points chart to encourage and reward appropriate behaviors. And the last one, make tasks interactive. Where possible, make tasks and activities interactive. For example, use whiteboards rather than always writing in workbooks. Ask the child with ADHD to hand out the whiteboards. This will help expend some energy and make them feel that they have an important role in the classroom. A child with ADHD may have difficulty sitting still and may suffer from exclusion and rejection from their peers. Therefore, it can be good to encourage physical activities in your class that all children can participate equally. This is Deshirie Nicole V. Pagdilao, and thank you for listening.